Alright, so I'm going to do cuff management and also with oral care. So the first thing I'm going to do is check the patient's chart, and then I'm going to gather any necessary details that I need and equipment that I may need. So I'm going to knock on the patient's room door, and so I'm also going to introduce myself, check the patient's ID band, make sure it matches with my charting and everything before I begin. I'm going to wash my hands, apply the appropriate PPE. I'm going to listen to the patient's breath sounds and also to get down the pre-vital signs before we begin. So when I'm ready, I'm always going to check the patient's endotracheal tube. So I'm going to check to see where the lip level is and see what size of tubing they have placed in. And then I'm going to go ahead and do the oral care. So you always want to have everything cleaned out. So you always want to make sure any excessive secretions are suctioned out before you loosen that cuff up, so that way they don't potentially aspirate anything. So we're gonna set up our cuff canister, our suction canister here. So we're gonna have that connected. You're gonna have a -100 and -120. And so you're gonna always have the anchor in the room when you do your oral cares. So with our oral cares, you always wanna try to do it within 2 hours with the patient. So then you're going to go ahead and suction the patient out first. So you're going to take the protective sheath, and you're going to turn on the suction, and you're going to suction the side of the cheeks, around the gums, and you're going to suction the back of the mouth, but try not to initiate that gag reflex. So when you're done, you shut it off, put the protective sheath back on, and you're going to remove your yanker to do your next step. So I'm going to do a suction swab cleaning here. So what I'm going to do is attach it to my suction handle. And I'm going to take my solution and I'm going to dip it in the solution. And I'm going to get the inside of the cheeks, around the gums, and on the tongue. And then when I'm done, I can suction out any of that excess secretions. I'm going to dispose of that. Then if I see any other loose secretions, any fluid, anything that needs suction out, I can go ahead and put my yanker back on and suction those out. So when I'm all ready to go, got the cleaning done, then I always make sure I do the moisturizer also on their gums and everything and their lips, so that way they don't dry out. So all that is disposed of, and so now we're going to go ahead and continue on with our cuff management. So you're going to do your minimal leak technique. So what you're going to do is, so here we have our syringe, and we're going to have a meter here. So you're going to connect your syringe to one end, then you're going to have a meter here. This is going to tell your pressure that it's at as you're releasing, and then you're going to take your cuff here and put it on to the other end there. And so when you're ready to do your minimal leak, you always want to listen to the side of the patient's neck here, so that way you can hear as soon as you initiate that first leaking sound. So you always want to chart that down. So when you're ready, so you're going to take your syringe, and while you're listening, and you're going to slowly move back until you hear that first initiation of that leaking. So when you start hearing the leaking, you're going to chart down where you see the leaking at to where the pressure is at when you're at that point. So then you're going to do the next technique would be the minimal occlusion. So you're going to go ahead and start putting that pressure back into the patient. So once you stop hearing that leaking sound, you're going to chart down on on the meter it is at. So once you've done that minimal occlusion, so what you're going to take, so here we have another measurement to see what the cuff pressure is. So here's a common technique that they can use in hospitals. So you're going to connect it to here, and you're going to chart to see where the pressure is at. So you want to have it at the 20 to 30 range. And so if it's too low, so what you're going to do is slowly increase that range. And so say if you're increased too much, like above 30, so what you can do is take your red here, button here, and slowly decrease down to where you need it to be. So always you want to listen to the patient to make sure it is sounding okay, you don't hear any leaking sounds, and then you're always going to make sure it's not too tight. That way with this meter you're checking it's not too tight, so that way that doesn't cause any irritation in the patient's throat or anything like that. So when I'm all finished, everything is cleaned up and disposed of, I'm also going to reassess the patient. I always want to check the vital signs, especially after I loosen up that cuff that was with that endotracheal tube. And so with endotracheal tube, always notice like when it first came in the room where it was at. So if it was in the middle, you need to move it to the right or to the left, so that way you don't cause any sores in the patient's mouth. So after the patient is all okay, all the vital signs are good, and the machine is checked out good, everything, all the settings are okay, then you're gonna go chart on the patient's chart after you've washed your hands when leaving the room.